Good morning from Rise and Rise with Rakshita, Learning Point Wellness Studio. Today let's talk about joint health. Now, when we talk about joint health, most importantly people start talking about muscles and exercises. Yes, what we don't use, we lose. So we need to use our muscles, even as like we use our senses, brain, thinking, etc. But we need to also focus on certain catalysts and major nutrients. So major and micro always go hand in hand. Just like the famous example that calcium gets absorbed with vitamin D3 and magnesium. Today understand that for joint health we need sclerotia extract, read about it, along with vitamins A, C and also copper, manganese as minerals. How does it get absorbed? Okay, so there is contraction and relaxations of muscles when we break, okay, during exercise. Now when glycogen or sugar is required by the muscles which are activated, we need to give the apt amount of fructose, maltose, sucralose sugars. Okay, so read about these kind of sugars, okay, which are natural and sucralose doesn't get absorbed, so it gives you that feel good factor. In plant-based proteins and the supplements, everything is made available by the formulation of weight samples in proportion. Another joint health nutrient is macro. It is nothing but your omega-3. How does omega-3 help? Obviously, it's good fatty acids, EPA and DHA. So it helps in lubricating the joints, and believe me, they are amazingly helpful in feedback mechanisms. So it gives nerves and brain coordinations with your muscles, joints and every other organ too. So omega-3 plays a vital role in all your health, as does proteins, as does fiber, as does any macro or major nutrient. Thanks for watching. All the best. And you can ask me questions if you have, as per your age, discomfort, etc. I'll be glad to assist and support you. So, do only sports people need to look after their joints, or aging people? No, my dear friends. We all need to build flexibility and, most importantly, strength in our joints. So our ball and socket joints have various kinds of motions. Okay, they have hinge motions, they have rotating motions. There are even different kind of rotating motions, and they also need a little strength bearing capacity, and so that we do not have fractures, or we help to get easy recovery and repair from injuries. Again, we need to look after muscle and joint health. Another important thing that you have to understand is, during aging, anybody can face deficiencies even in growth or aging stage, and it can impair your movement. So if there are some people who cannot move properly, who cannot tie their own body, or who cannot do simple actions like, yes, these are simple actions, or touching or clasping their both fingers or hands. Now if we are unable, or if we have certain such impairments of movements, or slump in the back, regular pains in the upper neck, lower back, or certain parts, even joints like knees or hip, or some have heel pain, or certain particular places, that has to be again diagnosed by my doctor, whether it's uric acid deposits, whether it is some kind of arthritic or rheumatism or other joint health issue or muscular issue. Okay, and if we want to overcome that, then first is start doing the things which you have not done under guidance, like for exercises, for food changes, and most importantly to get rid of your discomforts, because your discomforts have some causes in your lifestyle, and we as trained and certified coaches know to identify them, not just identify but help you give alternatives for your allergies, for your things which you were giving you trouble, and get you back to the normal lifestyle which everybody enjoys. Thanks for watching.
You sound like peanuts. I love peanuts. Well, thank you. You smell like